to get them up with the best of intentions on the Chamber's YouTube channel within 2 business days of each of the sessions. And so far, we've been almost on time with that. So we're going to keep working at getting it to be on time with that. So, and you can send links out to anybody that wants them and share those links on our YouTube channel with anyone. And we keep them up there, so you can always go back and source them. During the cafe, if you have questions, just throw them into chat. We had some questions come in also on Facebook. And so when we get to the Q&A portion of the program, I'll kind of throw those out there for our panelists to respond to. They were all, thankfully, very respectful, and we were grateful for that, and had some interesting information they were looking for. And so with that, Willie, you know, I'm going to put you on the spot, but we're going to call on you first to tell us a little bit about what you do in the big picture and what you're doing now, and what you hope with emergency management to learn from these public sessions.
Yeah, can do. So I'll start off with just a little bit of an overview of what the Department of Emergency Management is, since I think that there's still some folks aren't 100% sure exactly what specifically we do. I'll talk a little bit about our COVID-19 response and what we've done thus far. And then, yeah, I'll go ahead and just open it up for questions from there. So the Department of Emergency Management, we're the central coordinating disaster agency within Jefferson County. And we are a county department, but we are the emergency management agency or department or what have you for both the city and the county. We're a very small department. I'm the only full-time staff member actually in the Department of Emergency Management, although we do have a couple part-time staff, and we're really powered and fueled by a lot of dedicated volunteers. So we have a great volunteer team who actually end up doing most of the legwork for our department. Our job is to help Jefferson County prepare for, respond to, and recover from major disasters. So normally in blue skies time, as we call it, so when there's not a major disaster affecting the county, we prepare by holding exercises and trainings for both our professional partners and for the community. We do a lot of outreach and education, trying to get individuals to focus on their own personal preparedness. Through a partnership with Local 2020, we have an initiative called NPREP, or Neighborhood Preparedness, that really empowers individuals to take charge of their own preparedness to build community resiliency. We provide training on how to build your own emergency kit, prepare your family. That NPREP function uses a program called Map Your Neighborhood, which trains folks how to basically check in on each other after a major disaster, with the whole premise being that government can really only do so much. And oftentimes after a major disaster, most of the really great work that gets done is just simply neighbors helping neighbors, and the community steps up to help each other. So we put a lot of work into that arm. We write all of the county's disaster plans, whether it's our comprehensive emergency management plan, which kind of dictates how all the different response agencies work together. We also are in charge of the hazard mitigation plan, which is a series of strategies on how we can reduce disaster vulnerabilities within the county. And a lot of kind of general work with FEMA, with the state EMD, a lot of coordinations with a lot of different partners. During COVID-19, DEM helps staff and operate the Emergency Operations Center, which is kind of the central coordinating point and coordinating mechanism for the disaster response. So during most traditional disasters, if that's even a real thing, things like wildfires, winter storms are probably our most common disaster here. The EOC is a physical place where all the response partners get together in the same room to solve problems. During COVID-19, obviously, that's been, being together in the same room has been frowned upon. That's why we're all here on this digital meeting. So EOC is as much a digital place as it is an operational concept. So within the EOC, we bring all of the different partners and stakeholders together to, again, work on a common set of problems. So we have representatives from public health, Jefferson healthcare, the 5 fire districts, law enforcement, all those different groups to work together on our community response. We have a group within the EOC as well that includes city leadership, county leadership, leadership from public health to set the policy for the response. Within the Emergency Operations Center itself, we have 4 different sections who comprise the bulk of the work. We have operations, planning, logistics, and finance. So the operations group, they're the boots on the ground. They're the folks doing stuff like public health and Jefferson healthcare. Our planning team, their job is information management. So they're helping us assemble our plans. They're collecting and disseminating data so that we're all kind of operating under a common set of facts and assumptions. Our logistics team, they've been honestly, if I had to pick some of the superstars within our own internal EOC team, our logistics team have been absolutely incredible. They've distributed nearly 200,000 pieces of PPE over the course of the COVID-19 response. Everything from obviously our partners in healthcare to our first responders. They've been working with our local mask making groups to distribute masks to low-income communities and other individuals who might not have access to masks, et cetera. So the logistics team has been all about pushing stuff and getting the tools into the hands of both the first responders and the community. Last but not least, the finance section, they're the ones doing cost and expenditure tracking. They're also working with FEMA as there are reimbursements available for a lot of the costs that we do incur during the coronavirus response. Of course, with other federal funding sources, things like CRF or the CARES Act, they've been working with the city and county to again help track cost expenditures and again get that money into the hands of the folks who've incurred expenses during this response. So that's the kind of high level overview of what the Emergency Operations Center is and does. Again, we've trying to act as that central coordinating point, the place where everyone can come together and solve problems. So DEM, my department itself, is very small. During times of disaster, we bring in a lot of different stakeholders, a lot of volunteers, a lot of different players to all coordinate under that Emergency Operations Center, that incident command paradigm. That also includes, the last thing I'll note, we have had a liaison specifically into the business community and they've been working very closely with you, Arlene, to try to feed information about what's going on with Jeffco Cares and needs and things like that. But although that liaison system has worked, I think, decently well over the course of the response, one of the reasons I'm here is to kind of, hear it straight from everyone as the director of DEM. So we've made sure to include a link to the business community in our emergency response structure, but I'm also excited to be here today and hear it directly from you all.
Awesome. Wow. Okay. Well, what do you do when you're done with that? I'm seeing, I'm just, oh my gosh, so overwhelming. And right now, there's so much going on around us that, a pandemic isn't enough to deal with. So, and we were talking just before the meeting, there's a little smoke in the air. So how do you get ready for these multiple piggybacking disasters in a place like Jefferson County?
So in emergency management, we have a concept that's called all hazard incident management, where when we're writing, let's say, our comprehensive emergency management plan, and that's the single, and it's available on our website if you're interested in some light reading over the course of the weekend. That's the plan that dictates how we respond to any hazard, any emergency. It's moldable, it's flexible, and it's kind of founded on a set of core basic concepts that enable us to be nimble and agile and respond to something, disasters as diverse as a major earthquake, a hazardous material spill, or a pandemic. So whenever we're writing a plan and we're exercising and training, it's always with the idea in mind that we have a set of core principles and a set of core activities that we can then mold depending on the situation. But then that flexibility is key building off that core plan. So knowing how the core plan might be tweaked in the face of an earthquake, how the plan might be tweaked in face of a pandemic. But then of course you mentioned the idea of kind of cascading disasters. So one on top of the other. And that's where having that core set of principles is very helpful. But I will be the first to admit that, having a global pandemic on one hand, combined with wildfire smoke, where you want to close the windows and kind of sequester yourself from that fresh air. And then during the pandemic, you want fresh air and you want that circulation. That's something that we kind of talk about as a worst case scenario, but didn't really envision it happening. And I'll also be the first to admit that, historically in our preparedness here in Jefferson County, we did tend to get a little hyper-focused on things like the big Cascadia subduction zone earthquake and didn't really talk enough about the very real threat of a pandemic. So in a lot of our work and a lot of our preparedness, we would operate with the assumption that all of our technology would be wiped out during this big earthquake. So we wouldn't have access to cell phones or electricity or Zoom. And now here we are during the biggest disaster, arguably in US recorded history. And here we are talking on Zoom with kind of the full suite of technology that we have available. So it's really about having that core preparedness mindset and that plan that's flexible and adaptable, and then being ready to really, I don't want to say improvise, because you want to have your plan well written where you don't have to think things up on the fly, but have a core plan, make it all hazard so you can be flexible, and then be ready to be flexible depending on the situation.
That is pretty amazing. And this is a relatively unique scenario. Does anybody have a question? I'm sure there are 50 or 60 floating around the space that Willie can field right now, because we don't often have bi-directional access. We see him in meetings a lot on Zoom, but we don't get an opportunity to ask those burning questions. So we have some new faces joining us. I'm glad some more people are getting in. We're struggling a little bit on the back end of here with getting people through a Zoom firewall, it seems. And one of them is one of our speakers. So I will tell you what did come up, and that's, last week, the bridge got closed because of smoke, Willie, that you couldn't see where to drive and they closed the bridge. So what happens when you need to actually leave the peninsula and the bridge is closed? It's one of those questions that we're hearing a lot these days as people, for a really good reason, start to think about, what is my escape route? How do I get out of here? And I love that they're thinking about it, talking about it.
Yeah, so I guess the short answer is when the bridge is closed and you have to leave, it's time to take the long way, unfortunately. Well, with emergency responders, if they're, they are have good relationships with the medevac companies, and they do talk and exercise regularly. So there will always be that kind of immediate emergency access if they do need to fly people out of here. However, when that bridge is closed, it's unfortunately closed. And so that's something that folks should take into consideration when they're stocking up their emergency kits and building their emergency plans, is that we are prone to isolation. And it's not just the county or the peninsula as a whole. After a major earthquake or during a winter storm, we are prone to being even isolated from each other. So it's not like when the bridge is closed, we can guarantee 101 is going to be open as well. There are several areas prone to slides and closures as well. So it's just really essential to kind of come to that understanding and realization that one of the prices we pay for living in an area that's so beautiful and so just phenomenal is the fact that we may be cut off from the larger areas. So it's unavoidable to a point, and it's more about accepting that and being ready to deal with it than it is about trying to find some secret tunnel underneath the Hood Canal or something like that.
So the plus side is we are a maritime community and there are a lot of boats. So that is sort of the secret tunnel, only it's not quite that secret. But it doesn't help everyone, but it is another option that's come into play in some of the areas now that are experiencing some challenges. So something
And
always to remember.
We do have an excellent program, and it's not just here locally, it's actually starting to spread across both the state and the nation. And it's called a couple different things depending on where you're at. Here locally, we call it DART, or the Disaster Air Response Team. And it was founded after some disasters back on the East Coast when these communities were truly cut off and they were isolated from the outside world. And the only way to resupply them was to use small single-engine aircraft with private volunteer pilots to fly in, small amounts, just a couple 100 pounds of supplies at a time for delivery to these small communities. So we have that program here in Jefferson County. We have included some private boat owners in it as well. So we can both help potentially evacuate people out using private boats or private pilots, as well as bring supplies in. We did have a big exercise last year. It was actually last September at the Jefferson County Airport, where we flew in, I want to say it was nearly 4,000 pounds of food that was donated in Bellingham, Walla Walla, Kitsap County, Clallam County. I believe even someone flew up from Lake Tahoe, California. They flew in all this food from out of the area to the airport. We had some of our volunteer community emergency response team members unload it, organize, and sort it, and then actually delivered it to the Jefferson County food banks. So we understand the fact that we might be isolated, and we've been doing some work to help utilize our other options to, again, bring supplies in during a major earthquake. We were actually due to have another one of those drills actually this past Saturday that unfortunately got canceled or postponed due to COVID-19. So that's one of the things we were working on, considering where we live. But I'll also just restate that, we have some of these options, but it really is up to folks to take charge of their own personal preparedness and not necessarily rely on that. But there are workarounds.
I know we talked about putting together some programs to help some of our businesses start to really think that way and think cohesively about it. And where I'm sort of hoping as we wind through this pandemic that we'll start looking at piggybacking that picture onto what we're doing now. Because I think it's good for us while people are talking about it and thinking about it to take advantage of that and help them formulate those plans and ideas. And most of them haven't yet. They're just trying to make it through a week or a month. And so the big picture is just starting a little bit, I think, to become a reality. And it's nice to hear that. It is nice to hear that. And so Pinky is still trying to get in, and we're trying to find David. So what other questions do you guys have for Willie? Kina.
You always have to figure out how to unmute when you raise your hand. Kind of takes a little while. Willie, very impressive that you have such a robust emergency preparedness plan. And certainly one of the challenges we face as a business is, along with the COVID, was being required to actually have a preparedness plan in place. And fortunately, we were able to find some templates and adjust them for COVID. But I wondered, is there any resource out there that you know of that sort of has a boilerplate emergency preparedness plan and people who are willing to help you work through yours to sort of strengthen it?
Yeah, so both the FEMA, the Federal Emergency Management Agency, and the State Emergency Management Division, I think I referred to them as EMD earlier, they both do have some pretty phenomenal business plan templates. I think FEMA is the one I end up recognizing or recommending the most. Unfortunately, that was something that Arlene and I'll pat ourselves on the back just a little bit for talking about the need to develop a kind of more locally flavored emergency planning template, as well as the need to actually provide some mentorship to businesses. We were talking about really kind of an organization and meeting space to talk to businesses about emergency preparedness and talk about what we do at DEM. And the idea was right, but the timing was very, very poor, and that we never got it off the ground before the pandemic hit. So there are some good templates out there. I can make sure to send them to Arlene, and she can blast them out, some of the ones that I've recommended before. Unfortunately, it's very hard to find kind of the mentorship that you're talking about. We're always happy to take a look at your plans here at DEM, but again, being so small and being volunteer driven, and during this response, I've absolutely worked my volunteers into the ground. I can't guarantee we'll be able to give you, I think, the personal attention you really deserve, but locally at the very least, we're happy to do our best to provide that mentorship when we can. But FEMA, the State Emergency Management Division, but I'll make sure to pull out a couple of the good ones, because I think that's one of the big problems, and I don't mean to speak on anyone's behalf. I think that's been one of the big problems for not only the business community, but for everyone during COVID-19, is it hasn't maybe necessarily been a lack of information, it's been an abundance. And there's been so much out there, and you can spend so much time searching and looking and trying to find something that, at the end of the day, you might as well have just made something from scratch. You spent so much time sifting through sources. So I'll recommend those two, but then I'll make sure to follow up and get you all what I feel are some good ones.
So, and you and I can exchange information. The U.S. Chamber just put out in the last few days a huge program for small business emergency management that I want to run through you. So good timing. And since Pinky is still trying to push her way through the Zoom barricade, I know that John wants the floor. So I'm going to give it to him, but he's going to have to cede a tiny little bit out of his session for Pinky to make up for it.
And Arlene, I can participate by phone. It's just that I'm not in on the screen.
Well, at least we have part of you. But let's let John elbow his way in here, because I know what he has to say is really.
Arlene, are you speaking to this John here? Yeah, oh, I have nothing I need to say. So go for it, Pinky.
Okay. So, Pinky, we love that you were able to dial in. We just don't know what's happened. So thank you for blasting through the Zoom barriers. So,
yeah.
What we've had Willie do is to talk a little bit about what their department's doing and what they're doing now, and what you sort of hope to get as a takeaway from these public sessions. How can we help you help us?
Yeah, so I'm Pinky Mingo with Jefferson County Environmental Public Health. I'm the Environmental Health and Water Quality Director. So what comes under this division is food service, our on-site wastewater management, living environments, which is pools and schools. But I think mostly the intersection here with the Chamber Cafe is, with our food service. And I think one of the things that I'm most interested in is really in hearing from the community in terms of, I think the question was, how can we help? I know that, we've been trying to be very flexible, particularly with food service and, keeping businesses working out there. So I think that that's what I'm interested in hearing from folks today in terms of some of their challenges and some of their needs out there. I mean, I can go into a whole bunch of what we do, but you probably don't want to hear that.
Well, I think we do want to hear some of that because some of the questions that came up in Facebook and in the Facebook chat were just nationally, public health has not been having a great reputation of late. And yours is stellar at our local public health. So one, how have you managed to do that? And the other is, how do you avoid being seen as an agency to be feared instead of the agency that is guarding the public health?
Those are both great questions. I mean, I can't answer for, the national in terms of, what's happening. I know here from being in this community, in terms of public health, I mean, I think that I think Dr. Locke is a large part of that, that he brings incredible leadership, guidance, and direction to the public health agency here, that he's very pragmatic, very practical, and level-headed, and speaks, very freely. And I think that's, one reason why we have, such a good reputation. But I also think that it's part of the community. I mean, the people that are here because they hold and have values of, of certain beliefs. And I think that those two are, kind of in a line in terms of how we're protecting not just ourselves, but our community. We're a very community-oriented place. And I think that's, the other difference. I always say, I'm on the bubble of the bubble. I live on the West Coast, and then I live in, Port Townsend, which is the bubble within the bubble. So I think that that's part of it. And then the second part, say the second question again, in terms of, that was a really long question.
I think the question, if I can sort of unpack it from Facebook, was how do you avoid being seen as the organization that's an enforcement agency instead of the one that's protecting the public's health, which is what you do?
Well, and I think here, I think part of that, again, is communication. We've had a lot of communications within the community, particularly here, in the Chamber Cafe. And I think one of the things that we've always done, we step out with our education foot almost all the time. We're rarely about enforcement. If you go back and read all of the, public health statutes, it really is about educating people. I think one of the, cautions that Dr. Locke had in the very beginning about going forward, like with this mask ordinance, and coming down hard, is that often doesn't work. It often, kind of backfires. But, that was a progressive thing. We went out there and we educated first, and that's what we've always done. Our food service inspectors, our on-site inspectors, all of our staff here, they lead with education, because the thing is, if people don't know what to do and they understand why they need to do it, they typically do that route. There's a very small percentage of people that, when given the information, blow it off. That percentage is very slim. There, it is out there, but I think by and far, most people, when they understand the why about doing something, they much more easily follow along and do that.
So COVID fatigue seems to be a very real thing, that people have been dealing with this now for 6 months. It's not going to end anytime soon. And I think the reality is really set in. What's next for public health? What's the next? How are you going to keep this fresh? How are you going to keep people engaged? How are we going to keep this very low rate of transmission that we have here. How do we keep that going forward?
Well, it takes the community to do that. It's not just public health. I think that's one of the, the biggest messages that we can deliver, right? We're just the agency out there with the information. The more that we put the responsibility in each and every one of our hands is how we're going to keep that, that transmission risk low. It's because it doesn't happen through enforcement, right? It happens through behavior change. It happens because people are out there, they're, asking their customers to mask up. They're telling them why they need to mask up. And yes, COVID fatigue is out there. I was out eating at a restaurant last night outside, and I was really disheartened to hear, the wait staff, tell a story about how, she's had to go back into counseling because people have been mean and rude. And I think that people, all over the country are kind of, have that COVID fatigue. We're all stressed out. We all have too much work. And then we have not only the COVID, that now we have, the wildfire smoke. And so our ability to get outside now has been dampened, and people are getting, a little upset. But I think that, that COVID is real, and really kind of going back to, that doing one thing at a time, or, having one goal at a time, as opposed to trying to eat the whole apple, eating one bite of the apple or one bite of the elephant. But yes, and I think one of the risks too of COVID fatigue is that people get lax in wearing their masks, lax in washing their hands, and we have to be vigilant as a community. We have to be on top of that.
So I know that people are concerned when they see a challenge in the community, when they go into a business and they see employees not masking properly. There is a tremendous hesitation in confronting them. What do they do? How can they deal with that? What's rather than, escalating that into a situation, what's the best policy for them?
And you're talking about employees not wearing masks, or you're talking about customers not wearing masks? I think I heard employees.
So yeah, I think what I've heard, which is really kind of interesting, is because we hear a lot of both sides of that, but in the last several weeks, there have been a couple of local businesses that have been brought to my attention multiple times, where perhaps the people that work there are masking improperly, where maybe the mask is covering just their mouth. And it's concerning to the patrons of that business.
Mm-hmm. Well, one of the first things that we've asked, we'd like to ask everyone to do is, to let the management know that they're uncomfortable with that. Because again, just leaving it to, one entity isn't going to necessarily move the needle on any type of enforcement. People need to know that, that it's a concern and how it makes them feel, and also, kind of shopping, with your dollar. If you're uncomfortable, people might let the business know you're not going to come back if they're not, doing the right thing. But in terms of, what they should do, they can always file a complaint. And if it's with employees, that is with labor and industries as well. And so we try to be very judicious in, referring anybody to labor and industries. We like to start, first with us, and again, do that education and outreach. We often call them, and we also look at, patterns in terms of if we're going to, escalate this. Is this just a one-time thing? Is this, are we getting these from, multiple reports of the same thing? But by and far, most of the entities that we had gotten complaints on in the very beginning and have worked with them have stayed pretty compliant.
And that's really good to hear. And it was for a long time that people just weren't educated. They didn't know the right way to do it. But now I think we've been masking up for a long time and people understand what they should be doing. I think it's, at times they just get sloppy or it's uncomfortable and they have to do it for a long period of time and they just kind of give up for a while and hope nobody cares. And unfortunately, people care.
Yeah. And then, the other thing too is I would, look around in terms of, perspective. So, maybe the one employee is not wearing the mask properly, but, out of the, 50 employees, or is it one employee or is it 49 employees, that are, improperly wearing it? And at that point in time, like the other day I was at the co-op and I hadn't noticed that my mask slipped down and someone politely pointed to my mask. And I really appreciated that. And I was horrified that I hadn't noticed it, right? But things like that do happen. And that little polite pointing to your mask and to pull it up is, to me, it's like, I appreciated that. And obviously we all have our different reactions to things like that. But by and far for me, I want to know that, right? My mask slipped off and I didn't even notice.
Interesting. Yeah, I mean, and I think most of us, will forget our mask or, we have people come into the chamber who are like, we open the door wearing a mask and they're like, oh my God, it's like, not to worry. Did you want a gray one or a pink one? We can match your outfit. I have some paper ones. What works best for you? So we have them here and everyone should, and masks are available. Willie, how can people find mask resources? I know that for some groups, those are being distributed, and for others, the chamber has a few resources available.
Yeah, so we've gotten through the State Emergency Management Division tens of thousands of masks specifically for the low-income community. And so we've been distributing those out through, organizations like OLICAP and Dove House and, service organizations. We've also been using the schools specifically to distribute some of the child-size masks as they've been restarting. Public health, as well as DEM, are also points of contact if for folks wanting to receive masks. Right now, our stock is still limited to those specifically for the low income population. However, we're hoping, we think we're at the point where that distribution is slowing up, where we can make the rest of our stock available to the general public, so we can give them to businesses to hand out to folks who might have forgotten. In the meantime, though, we still do have some masks that were made by local community mask makers that are available to the business community. So feel free to reach out to us at DEM if you are looking for a couple to be able to distribute.
Super. And then I have a question from Facebook for both of you, and which is really clearly a question for David, but apparently he can't be with us. That is homeless housing and the pandemic, and where do we go from here? We look outside and fall is clearly stepping up, and we have weather here in Jefferson County and it's coming on us and dark is coming. So where do we stand? What is the fairground going to be changed? What's going on?
Yeah, and I can go ahead and take this one. And you're right, it really was a question for David. I'm not sure specifically how much, I for one don't have the full picture. I don't know how much I can truly share other than obviously early on in the pandemic, we at DEM and in the EOC were working very closely to help find a solution that would really the short-term goal of preventing the spread of COVID-19 amongst the homeless community. And thus far we've been moderately successful, at least as far as we know, and that we did have some temporary accommodations, and again, we're supplying them with PPE and kind of closely monitoring that situation. We are very much aware that, with winter approaching, time is of the essence. I know that there are some ongoing conversations and plans that are moving right along. But again, I don't know how much I am really able to share, since at this point, it's kind of moved outside of that emergency operations, the COVID-19 response, and more into a broader conversation of what our long-term plans are to assist our homeless population. So I know this is super vague, and I'm sorry I can't really come up with a direct answer, but there are some talks ongoing, and I'm hoping the county will be able to release some more information in the next couple of weeks.
And when you do, we'll bring it to you, because I know it's a real burning question. And I think it's Chino Valley Animal Rescue would like to pose a COVID question.
I'd like to add something to that if I can.
Sure.
The difference between a recession and a depression. In a recession, your neighbor's out of work. In a depression, you're out of work. And the situation with homeless people is an emergent need, but it is an emergency. Understand that there are some things that are emergency. For example, how many people on this group, we're all muted, I can't see all of you, but muted, I mean. How many people have like a survival kit? You bet them at Costco's. They have rice, they have stuff in them. Anybody have those things? Yeah. Now, I'm with St. Vincent de Paul. And so we see a certain portion of the population, not just homeless people. In fact, not mostly homeless people at all. Mostly working poor. You also have to deal with them in this county.
Yeah.
Working poor, or the 77-year-old woman whose children moved into her house, and because she had the only stable housing in the family. However, they didn't bring income with them, so her meager income, which in many cases in this county, as some of you know, is $750 a month in Social Security and $194 a month in food stamps, and that's it. Those people, everything is an emergency. One of the questions I would have for the emergency management guy is, when this emergency happens, are you prepared at your house? Because the houses I go into and the people that we help, if they're asking me for a $50 food voucher, I can be reasonably sure that if something happened tomorrow, they wouldn't have enough to eat by the next day. And so there are some emergency things that need to be recognized as the emergencies that they are. Everybody's not as vulnerable as everybody else, and we all know that. The question we have to decide is, what kind of community do we want to live in? We certainly aren't thrilled about living in a community where it's okay to slam public health, which is not something that public health is responsible for, I might add. So when we're talking about all this organizational structural stuff, there are some basic needs that we can't let get out of our minds. And that in any kind of an emergency at all, food is a huge one. The other one, if you want to talk about the homeless population, what they've lost because of COVID is access to a computer. How many of you know, how many of you guys know someone who applied for unemployment and got it just fine? How many of you know someone who applied for unemployment and didn't get it? Let me tell you that the ones who got it just fine had a computer. The ones who had to wait, only had a telephone. That's the working poor. So their access is cut off in a variety of ways. And I would have to say that electronic communication and food are two basic values you need to be able to get out to people immediately. Immediately.
So John, there's
They're
some
not able
really
to
good
do it.
points. And I want to put a word in for Jefferson County here, because when all this started in the end of February and early March, there were huge concerns over some of the issues that you put on the table. And this community stepped up and has continued to fuel the food banks at a level that I've not seen anywhere else. And I personally, having been in other communities before this, was so impressed with the way the communities come together. And the conversations continue in various committees and groups on housing. And I know that Willie is going to circle back to us, and David, I'm sure, will also, on what is the actual state of affairs at the fairgrounds and all of the things that are being talked about now. But that clearly, John, those are huge needs and things that are identified as challenges that so many different groups in the community
Excuse
are
me,
working on.
that was, you just used two letters I don't understand. UGs or NGs or what did you say?
I'm not really sure, and I'm sorry. So, and it may have just been a word that got zoomed out. So, but I want to thank you for that and circle back to the Juno Valley Animal Rescue Group, who has a question.
Hi, I'm Sarah, and I've got Dr. Christine with me, and we just popped out of surgery, and I'm hoping it's okay to ask non-COVID type questions. We are hoping that our county representatives can give us some guidance. Center Valley Animal Rescue is, obviously we are here to help animals, which in turn helps people. But we are trying to work out fixing a county code, and we're not sure how to go about it. And there's a county code that states that any stray dog or cat has to go to the Humane Society. And it doesn't matter if they're sick, they're injured, what's going on. Up until the last year and a half, those stray animals had been coming here, and we didn't know any of that. And the sheriff's department or police department would bring them here, and we would provide emergency 24-hour care. And we are trying to figure out how we can get into that county code to be included as an animal shelter so that we can continue to provide for dogs and cats just like all of the other animals that we do, so the wildlife, the farm animals, the exotics, things like that, that 24-hour care. Or that could be disaster care if we have a wildfire. Right now, how the code is written, we are not legally allowed to take a dog or cat in. And the county right now, if say your dog escapes, it gets out, gets hit by a car, it's after hours, then that animal has to be taken. Sorry, we have a very cranky cat. I don't know if you can all hear that, but we can. We have that animal has nowhere to go after hours. There isn't 24-hour care except for at Center Valley Animal Rescue. And so that animal might just be stuck with a broken leg or a punctured lung, sitting in a cage suffering without care. And so we want to fix that. And we've actually offered the county and the city a free contract where we won't charge the county. All we want to do is improve welfare for the animals of our county. But we have to get into that county code, and we don't know how to do it. So I'm hoping you guys can help us.
So Deborah,
I'll just-
first of all, I'm a county planning commissioner, so that's a start. And I haven't read that part of the code, so I'm going to go off and read that and see what that's about, and we'll chat. But Deborah, do you have any words of wisdom that you want to share?
Me? No, I'm not. I'm not involved in that at all. Sorry.
Okay, Willie?
And
Yeah, I was just going to say, I'll bring that up with, when I connect with Commissioner Sullivan, I'll bring that up as a note for him. I'm not exactly sure how that would get changed, but I'll just say as a, dog owner myself, that's something that sounds like something we should be moving forward with, if at all possible. So I'll bring that up with Commissioner Sullivan. I'll also bring that up with Sheriff Joe Knoll, since it sounds like that might be something that our county sheriff's department might have some pull in getting that changed as well. And then obviously Arlene, I'll include you in that group. So yeah, thank you for bringing that up. Again, I'm not sure exactly how we can move forward on that, but I'll be pushing from my end. So thank you.
Yeah, I think
Thank
that's a really great point. And the community I was in before here was prone to forest fire. And when we had evacuations that took place, it became really apparent that we did not have a really good animal disaster plan. And after a couple of significant disasters, we put one into place. So anything I can do to help you with that, I certainly will. And it's having spent many an evening at the 24-hour emergency vet, I understand the challenges really well. So let's see what we can work on with you. Thanks.
All right. Thank you very much. We have to get back into surgery, so we're going to leave you guys.
And get that little cat for us.
All right.
Any other questions for the team here? And so I would tell you that John Morrow will be, and the city of Port Townsend will be featured at our next Chamber Cafe, which is the first Friday of October. And that is immediately preceding the Jefferson County Community Leadership Awards. If you haven't purchased a ticket yet to attend, it is on Zoom. We are trying to provide an entertaining evening honoring those people who have worked so hard to build Jefferson County and who unfortunately were not able to have a live event to do that this year. So we want to all stand up for them and show them how grateful we are for what they've done. So please go to the Chamber website and get on the registration list and help us support them. Any other questions that we can put out to the county or the city on our lists for public health or for emergency management or the supervisors, please put them in chat or send me an email and let me know. I want to thank our guests today. Thank you, Pinky and Willie, for an amazing job and for hanging in here and answering all these questions. And thanks to all of you who came here and who have been Facebooking as we do this and dealing with the vagaries of Zoom, who will be my next reach out to see what the heck is going on and why they threw a gate up at some of you, but not all of you. It's really kind of interesting. Some people that ordinarily have problems made it through, and some of you didn't. So we're gonna have to figure this out. But I want to thank all of you for continuing to support our community. It's time for us to really step up what we're doing. And for those of us who thought we were doing a lot for COVID, it seems like right now there is massive fatigue setting in our community. There is, excited as they are about low transmission and the great job that emergency management and public health are doing, the real work of keeping those businesses alive and keeping their employees employed is wearing, and it is getting to people. So I hope that all of us and our organizations can work together and step up and try to lift up this community right now and get us through this winter. So thank you all. Have a great weekend. Stay out of the smoke, and we will see you soon.
Thank you, Arlene.
Bye, you guys.
Thanks, everyone. Appreciate it.
Thank you. Thank you, Arlene.